March, the month of March, is National Kidney Month. And right now, more than 100,000 Americans are waiting for life saving procedures, that kidney transplant, with about 13 people dying every day because a match never came. Atul is the CEO of Kidneys for Communities, a nonprofit connecting donors with those in need at no cost. Atul, thank you for joining us this morning.
My pleasure. Thank you for having me.
And so you received a kidney transplant yourself about 10 years ago. Take us to that moment and what was life like when you were waiting?
While I was waiting, I found out quite suddenly that I had a kidney failure. I was applying for some additional life insurance, and that's how I found out. And it was a miracle that I found a kidney within a few months of finding out that I had a kidney failure. And that just, those 2.5 months were quite dark for me because I had a young family. But I'm eternally thankful to the donor's family that made the choice to get me the kidney. I went back to my corporate life. I was working as a senior leader in a Fortune 500 company. And then after a few years, I felt that my calling was really to help other individuals in similar situation, other patients. And so I left my corporate life and decided to operate this nonprofit, Kidneys for Communities.
I mean, an amazing story and journey to where you are right now and having that higher calling, Atul. So, a lot of people assume that a kidney donor comes from those who are deceased, but there are living kidney donors. Talk to us about that.
Yes, I think, and again, to appreciate either families that are making decisions to donate kidneys upon death or organs upon death, as well as living kidney donors, both are equally important because there's a severe shortage of kidneys. There's 100,000 people waiting for a kidney donation on a kidney wait list right now. They will wait 5 to 7 years, during which time half of them would either die or would be too sick to be transplanted. So it's very important that any kind of donations coming our way. But living kidney donation tends to last about twice as long as a deceased kidney and has better outcomes. Also, when you donate a kidney while you're alive, you live the life of knowing that you have saved some individual, saved another human being. It's not, I would not make any light of this donation. You have two kidneys, and science has shown that one can live a very normal, productive, normal life with one kidney. My dad was a donor, and he lived till the age of 95.
Oh, wow.
So, yeah, yeah.
Yeah, so that just shows you it is quite possible. It says here 90% of people with kidney disease don't even know they have it. And your own experience, you didn't know you were having kidney failure. What are the warning signs and what did you experience?
I actually, funny thing is, I've always been quite athletic, and so I was very careful, of with my diet and body and everything, and I had a global role, so I've never really felt any difference, and that's one of the common things that we keep hearing from other patients is that the disease kind of just creeps on you. In some cases, you have swelling, you have fatigue, you have, your complexion changes and you start getting darker spots. But you start getting higher blood pressure. But in my case, there was none of those indications. I was traveling around the world and having a normal life, and I had a young family that I was enjoying, so it was quite a shock.
And so, talk to us about Kidneys for Communities. How does your nonprofit work, and what is the community-based model like?
So we've studied the data quite extensively. We wanted to be an organization that creates direct impact on the number of kidney transplants in the country. When we looked at the data, we found that 96% of the individuals that have donated a kidney either donated to a family member or someone they have an affinity or identification with. And by that, what I mean is either they were wearing the same uniform as the recipient, or they went to the same church, or had the same belief system, or maybe went to the same high school. So as we studied where this emotion is the highest, we found that communities is where the emotion is the highest. So we started off with our program. We support a lot of communities, but I think particularly in this month, we're highlighting our support for the first responders. There's about 10,000 of them waiting for a kidney right now. And the pediatric patients, there's about 1,000 of them needing a kidney. We work with first responder organizations all around the country, big unions on law enforcement, firefighting, and EMT side, who help us get the word out about this disease and the suffering within within this community. And we hope that we share this information, someone's inspired and step up to donate a kidney and save a life.
Wow, that is amazing. So, for those who are watching us right now on WCNC Plus, what is your ask of people watching today?
I think I have an ask and an assurance to go with that. The ask is that you have two kidneys, and science has proven that you can donate one kidney and live a normal, productive life. And it's not to be taken lightly. It is a major surgery, so you will be in hospital for a day or two, and then take about a week to recover, and about a month before you can begin your normal activities. Our assurance is that, as you go through the journey, we will support you fully. We have individuals who have been in your shoes before. They are kidney donors themselves. They will guide you through this entire process. We will make sure that your costs, out-of-pocket costs like travel cost or pet care, child care, adult care, or let's say if you have loss of wages, that these are covered for you during the process. So any financial constraints, any guidance, any support that we can give, we will extend that fully to you. All you need to do is go to our website, www.kidneysforcommunities.org, and press on Become a Donor button.
Atul, amazing story, and it sounds like you're doing amazing work with Kidneys for Communities. Knowing at least two people who are recipients of living donor kidneys, I can also be a witness to those who are on both donor and donoree, that they are both living very high quality lives. So thank you for the conversation. Appreciate you this morning.
Jane, thanks for getting the word out.
Of course. Thanks. Take care.